first day of summer, as
Oh,
we've
no,
heard,
I appreciate it.
and National Sunlight Appreciation Day. But before you start to plan all those outdoor activities, you want to make sure that you are prepared when it comes to protecting your skin. Joining us this morning, we have Dr. Omar Eton here with us, the medical director of the Hartford Healthcare Cancer Institute Melanoma and Skin Clinic, with some sunscreen tips and more. Thank you so much for being here this morning.
Thank you for inviting me, Laura.
It is so important because it's so nice to be out in the warm sun once again, but it is so important to be protecting yourself properly.
Yep.
So let's start first by talking about what should we be looking for on our skin when we're applying sunblock?
Well, we'll talk about sunblock second. The skin is the largest organ on the body. It has the highest frequency of cancers of all compared to any other cancer.
Yep.
And so it's important for everyone to be vigilant.
Yeah.
So the two concepts are, one is early detection, and the other one is prevention. So the sunblock comes in under the prevention, but we'll go through the early detection.
Sure.
We have to remember that we have a front and a back. We also, I've noticed over 30 years, that women are better at finding things on themselves and their spouses than men do.
Right.
And we need to fix that, because it turns out there's a major epidemic of melanoma in men over the age of 60, 65. There's also in the women, but it's even worse, like at least twofold higher in the men. And these are the men least likely to examine themselves. So we have to start focusing on the skin a bit at home. We follow the ABCDEs. And you have to have someone else look at your back unless you have a double mirror.
Right.
But the idea is anything on your body that the E is the most important one, enlarging.
Okay.
God forbid it's bleeding, that's bad, or itching, something that's changing is important. But the ABCDs can distinguish them from benign moles, and that would be anything that looks asymmetric. Has a border irregularity, even a little bit lumpy. The coloring, we call it the red, white, and blue sign. Multiple colors, but it could be just black. It doesn't have to have multiple colors. It could be even sometimes pink, like on the scalp in older men. So color. Then the other thing is diameter. Anything larger than a pencil eraser head is worrisome. So those are the ABCDs really quickly.
Wow.
But it's important to, you could easily take a picture of, the Lincoln Memorial or something. You could also take a picture of your own body. Yeah. And you get a little plastic ruler, get someone to take a picture of you, or you can do a selfie, since it's selfie day as well today.
and just kind of see what's there, and it sounds
measure
like
it.
It's also important to watch as something evolves on you as well, because you want to see if it's changing.
Yeah, anything that's changing gets a visit to a doctor. Connecticut is great. We have wonderful dermatologists. We're detecting cancer all over the place all the time, the way we're supposed to. There's never enough dermatologists. Every time you put one in a community, they find a whole bunch more cancer. Wow. So we do rely on the patients to. The people to find it themselves. On the other hand, you might not be able to get into a dermatologist quickly, so you have to rely on your primary care physician, maybe a surgeon who's your who you can get into. And
is the recommendation still 30 and above for SPF? We don't have a lot of time.
So now on the protection side. We want to stay out of the sun between 10 and 3 if we can. We do need some sun. It's good to wear loose-fitting clothing, a broad-brimmed hat. The sun protection factor, SUV 30, is more than ample for most people, except when you go higher, you're not getting much more protection at all, but it costs a lot more. Right. So SPF 30 is good. 15 is okay.
Dr. Eton, thank you so much. I'm sorry we're out of time, but great information, and just so important to protect yourself and keep lathering up. Thank you
You're
for
welcome.
that.